In this month's Data Bites, we're exploring the ins and outs of data quality, how to strengthen it, how to measure it, and how to overcome common hurdles. For each section of this video, we'll have links provided in the description. Interoperability at scale, technical strategies for health data integration. In this webinar, learn how to consolidate, normalize, and enrich data from multiple sources. Drill directly into your interop challenges and discover how you can overcome hurdles to streamline reporting for better care. Watch the webinar on demand. Arcadia's Chief Product and Technology Officer, Nick Stipro, was featured in the Talking Health Tech podcast at HIMSS 2024.
We have these, honestly, pretty fundamentally broken point-of-care clinical systems where, if you have a complex patient, they're polychronic, they're on 20-plus medications, they're on, they've got 6 or 7 major chronic conditions, their health record history is massive, right? I mean, it's pages and pages. And so what we're really excited about is the advent of generative AI and these language models are actually coming just in time to save the day. As these data sets are getting massive, they're really, really good translation engines, and so they can provide context to a clinician at the point of care that says, I know that you're only here to see this patient about abdominal pain, so forget the rest of the health history. Here's the relevant facts for you in a contextual way that respects them as high-cost, high-skilled parts of the ecosystem.
VP of Data Operations, Mary Kuchenbrod, explains how healthcare administrators can safeguard their data with seatbelts.
I think about the strategies that you employ for data management as being left of boom and right of boom. So this is a term originally started in the military, where the boom is literal boom. And left of boom, right of boom is what do you do before something has gone wrong? And what do you do in response once something has gone wrong? This got picked up by cybersecurity. So left of boom, right of boom, before a threat actor has been noticed in the preventive actions that you do to make sure that you're keeping your system safe. And then right of boom, if in the circumstance where you observe a threat actor, what do you do in response? And I think about this in data management as well.
Schedule your data for a checkup. Mary returns in this feature on why EHR data can get messy, offering criterion for data health checkup.
EHR data is messy, and just one example of how something seemingly simple can get very complex very quickly. Think about a blood pressure. That something as simple as, 140/90, 2 numbers, and consistently, we think, kept and recorded and measured, and everybody knows what a diastolic and systolic blood pressure is. But if you are doing certain types of research where you need to know, was the patient in a reclining position? Where was the blood pressure taken? What was the patient's position and activity levels? There's triple-digit ways that you can actually record a blood pressure taking into account all of those variations. And so depending on your research question, that may or may not you may or may not have greater degrees of curation needed. If you're just looking to find hypertensive patients, just knowing 140/90 will do you fine. If you're looking into some very specific kinds of tachycardias and doing very specific research where that extra clinical context surrounding those 2 numbers matters just as much, you're going to have different needs and have a different concept of what consistent or inconsistent is in the data set. So as somebody who curates data, it's really on us to be actively looking at all of those different variances, all of those different ways that data might have been recorded, deeply understand what's going on with clinicians and in EHRs, and make the best decisions that we can for how to normalize that at the outset and keep doing so consistently over time, because EHR data is always changing, always evolving. You're always upgrading your system or adding new features or refining your workflows. So this is a constant exercise over time. And clinical research really drives a high degree of need for consistency in these areas. But a lot of other areas do as well in terms of the need to use that data for population health and to care for patients and ensure patients are getting the right care with the right resources at the right time. And so that's our work, and that's what we do day in and day out.
Read the article to see 4 metrics so your data insights are useful and manageable. Keys to the Data Kingdom. In this episode of Unlocking Big Data, Arcadia CTPO Nick is back again, discussing how you can build a foundation for excellent data quality.
I think the right data infrastructure and surrounding services enable you to meet all of those users where they're at, operating with data at varying gradations of fidelity. And as you also mentioned, I've spent a lot of my time thinking about data visualization, and the intent of data visualization is to take really, really complex multimodal insights and package them for somebody that might have a lower degree of context with that data and let them engage with those insights.
And that wraps up this edition of Data Bytes. You could check out the video description for additional resources, and also sign up to receive this newsletter directly to your inbox. To see more of how you can harness the power of data and analytics to drive healthcare innovation, request a demo of Arcadia's powerful data platform.